Now, joining me on the line to talk about how Namibia is preparing for any eventualities is Dr. Kalumbi Shangula, the Minister of Health and Social Services. A very good morning, Honorable Minister. Thank you very much for joining us.
Good morning, and thank you for having me.
Minister, we really want to understand, we have been seeing a declining or cases declining in the past few weeks, but it seems we are not out of the woods yet, given now the discovery of a new variant in South Africa. How is our preparedness mechanisms moving forward?
Yeah, well, let me first start by saying that COVID-19 pandemic is with us, and it will be with us for some time. We have seen that when cases were declining in Europe, they have now started picking up. And the possibility is there that as time goes on, more and more cases will also be detected. Now, we have always been prepared for any eventualities. This is just a new variant, but all its preventive measures are the same like all the variants we had in the country before. So during this time when we have been recording few numbers of new cases, hospitalization and death, we actually have used this opportunity to strengthen our responses. This include the strengthening of the health infrastructure, the bed capacity, the oxygen supply, the mortuaries. So we have been busy,
right,
and we are still busy strengthening those infrastructure.
Okay. Now, Doctor, there are also reports that Namibia will or is intending to discard COVID-19 vaccines that are about to expire due to low uptake. How true are these sentiments? And if so, isn't it better perhaps to use them as booster shots, beg your pardon, instead?
Well, the first thing actually which led to the expiry of the vaccine is that we received them with a short shelf life.
Okay.
Yeah, so that is the main reason why we could not use them up. And secondly, as a secondary reason is also that, as you mentioned, that not so many people are taking up the vaccines. And then you know that there is a strong anti-vaccine campaign going on. That has also contributed to the low uptake of the vaccines. And we have quite a wide variety of the vaccines available now. So the public has got a choice, and there are preference to certain vaccines than to others.
Right.
In actual fact, I think it may not be correct to make a general statement that the vaccines are expiring.
Right.
The only vaccine that are expiring is the AstraZeneca, which we have received with a short lifespan, shelf life.
Okay.
But others are not. Other vaccines are not expiring. Apart from the AstraZeneca, it's Sputnik component 1, which we also received with a shelf life of 1 month only. So it should be clear, correctly understood that when we are talking about the vaccine that are expiring, we are talking about two. That's AstraZeneca and Sputnik. The other vaccines, they are not expiring, and we are continuing to offer them. And also, not all the AstraZeneca vaccines are expiring. There are still some which are still valid and which have got sufficient shelf life for us to be able to continue using them.
Right. Doctor, before we let you go, the festive season is a few weeks away. Any messages or any message for the Namibian populace?
Yes, definitely. Let me first say that we have relaxed a lot of public health measures. It means now that the main responsibility shifted from government to individuals, family, and communities. I know during the festive season there will be parties, there will be wedding celebrations, there will be Christmas celebrations, New Year party, etc., etc. Now, these events, they attract big number of people. It means people will have to come together. And that is the fertile ground for the transmission of infection. It only requires one individual to be positive to infect all the guests at one event. So my takeout for the public is that let us not lower our guards.
Yeah.
COVID is still with us. And then let us take up vaccination and observe all other public health measures.
Minister Shangula, thank you very much for sharing with us.
Most welcome. Thank you very much.